The Heartsine 500p is the lightest and most economical life-saving defibrillator on the market. This AED brings you one step closer to saving the life of a friend, family member or colleague. The Heartsine 500p is simple and easy to use, even by an untrained bystander. Within 3 minutes of someone suffering a cardiac arrest, and with access to the 500p, survival chances may increase from 4% to 74%. For further information on the Heartsine 500p defibrillator, and to see how simple the device is to use, keep watching. It may just save a life. The Heartsine Samaritan 500p features real-time CPR feedback and guidance, an audible metronome, verbal and visual prompts, and is semi-automatic, meaning the rescuer controls when to shock the patient.
Just go back into the side. James! James! James, are you okay?
Check the patient's response to talk and touch.
James. James.
Touch or tap on the patient's cheek and ask if they are okay.
James, are you okay?
If no response, call 000 ambulance.
Beth, call 000 and get the defib. James. James.
The Heartsine 500p is simple to operate and will guide and coach you through the rescue with easy-to-follow verbal and visual prompts.
James.
If the patient
James.
is below 8 years of age, you should remove the adult pads and insert pediatric pads. Press the green on button to turn on the defibrillator.
Call for medical assistance. Remove clothing from patient's chest to expose bare skin.
Pull the green tab to remove the pads from the 500p. Peel the pads from the liner and apply them to the patient's chest as shown in the pictures. The 500p will start to analyse the heart rhythm of the patient and instruct if a shock is advised. If required, the semi-automatic 500p will prompt the rescuer to deliver the shock by pushing the orange button.
Analyzing. Do not touch the patient. Shock advised. Stand clear of patient. Press the orange shock button now. Shock delivered.
The 500p will inform you when it's safe to touch the patient
It is safe to touch the patient.
and prompt you to begin CPR. The 500p has an inbuilt metronome and provides real-time CPR feedback to ensure even untrained first responders provide the best possible assistance to the patient. The 500p will tell you where to place your hands and the force and rate of compression in time with the metronome.
Begin CPR. Push slower. Good compressions. Stop CPR.
Move back.
Assessing heart rhythm. Do not touch the patient.
The 500p will then advise if another shock is required. Continue providing CPR until either the patient regains consciousness or emergency services arrive. After using the 500p, or after 4 years since purchase, you will need to replace the battery and pad pack. Press the 2 locking tabs on the side of the battery and pad pack and slide the pack out. Insert the new battery and pad pack into the 500p until the tabs lock into place. To ensure your defibrillator is working, once a month, simply check the light is flashing, and you can rest easy knowing your device is ready to go in an emergency. AED Authority Australia is the leader in sales and management programs of defibrillators. Simply saving lives is the core of our organisation.